Hey guys, welcome back to the channel. This is Sai Dental Vlogs and today's topic is very important. Today we are going to discuss about whenever a patient comes to our clinic, usually they want treatment and you explain the treatment very nicely to the patient. But what suddenly happens, the patient tells you, okay, I'm going to come tomorrow and do my treatment, or they tell you in a different way, okay, I'm going to ask my relatives and then after that I'm going to come and do the treatment. Even it has happened to me as well that patient takes the phone and he tells, okay, मैं call करके आता हूँ, घर से पूछ के आता हूँ, and the patient is gone. So this is very common in practice and I'll tell you why this happens. So first of all, whenever a patient comes to your clinic, so you have to be confident enough and you have to be presentable. That is the most important thing which is required by the dentist, like your appearance. Yes. So whenever the patient comes to your clinic and you are sitting idly and shabby, so the very first impression is very wrong. Like even if you are very good at your skills and if you are very smart, but if your overall appearance is shabby, then what happens is patient को ऐसा लगता है कि अरे ये डॉक्टर शायद अच्छा नहीं होगा उतना. तो what patient's mind, like whenever a patient thinks about a doctor, he always thinks, okay, the doctor is in a very like well dressed and neatly groomed. So that is really required if you are opening a dental clinic. So अच्छे से groom करना is very important. First thing what I would tell, like according to my experience I'm telling, okay, not according to any book. Second thing, whatever treatment plan we are telling to the patient, it should be the chief complaint of the patient, right? Suppose the patient is having a carious tooth which is small and having pain, compared to the other quadrant tooth where the size of the tooth is, the caries is very large size caries lesion and we are concentrating more on that particular tooth rather than the chief complaint of the patient. Then patient loses trust in you and he tells what he's telling, I'm telling about this tooth, and like he'll think in his mind that the doctor is telling about the other tooth and what I have come for, he's not checking my chief complaint. So that is the second most important thing. Third most important thing which is required is improper diagnosis and failing to know the treatment and the failing to know the management and the main complaint, why the pain is happening, whatever situation, whatever swelling, whatever condition is there. So these three things are very important in order to convert your OPD into your real patients. Means if you are going to tell the patient, okay, you have to do the RCT and this tooth is going to stay forever. One more thing which I would like to add is कि whenever we are telling the patient any particular treatment, so obviously any persons, they will ask like they will ask a simple question कि how many days it's going to last, or what is the warranty, whatever, like how many days it's going to last, because the patient is going to spend money, right? So he will obviously ask कि कितने दिन तक चलेगा. So at that time you have to answer that I am giving my best treatment and I am doing the best materials I am using, so it will last long. Okay, you should not particular tell, okay, ये 5 साल चलेगा या 10 साल चलेगा. It's not like that. It's human body. Okay, but I'll try my level best to give the best treatment to you. So you have to be confident in what you're saying, right? And you have to make sure whatever you're doing is correct. You have to make sure, even if you don't know the right procedure, right? Suppose you know that impaction has to be done. Even if you have not done too many impactions, you know that you will call a consultant and do the best extraction for that patient. That you have to tell the patient in, like, suppose sometimes what happens is we are scared to tell all these things to the patient because patient, you think that patient will think, okay, I don't know impaction and what the patient will feel. It's not like that. You have to tell the patient confidently that this tooth is about to get extracted and it's very near to the nerve, which is the inferior alveolar nerve. So I need to call one specialist. He will do it with very flawless he will do and without any bleeding or without any complications, and it will cost you this much. So if you show confidence, if you are confident in your clinic, so really that patient will come to you and get the treatment done. And if you answer like this, हाँ root canal तो रहता है usually 5 साल, उसके बाद देखा जाएगा अगर कुछ problem होगी. So if you are underconfident or if you don't talk properly and present yourself properly, so that also leads to patient will go from your clinic to another clinic because he will think कि ये शायद नहीं कर पाएगा, शायद मेरे दांत में फिर से प्रॉब्लम आएगी. तो you have to be very sure and minded guys. If you don't know any work properly, right? अगर आपको कोई काम रूट कैनाल नहीं आता तो नेवर ट्राई ऑन द पेशेंट, नेवर डू एक्सपेरिमेंटिंग. दैट इज वेरी इंपॉर्टेंट बिकॉज you are working on the patient's human body, right? So it should not be like that कि आपने ज्यादा extraction नहीं किया and you start extracting a firm tooth and the tooth breaks and do all the surgeries and bone cutting, and after that you are not able to extract the tooth, then you are telling the patient that I need to call a consultant. So that's a very bad approach. So you have to you have to take a IOPA or X-ray, whatever OPG is required, and then you tell the treatment plan to the patient. If possible, take the radiograph of the patient before doing any kind of procedure, because that will give you a hell lot of idea ki okay, this tooth is difficult, the bone is dense, okay, there is bone loss, there is furcation involvement. Suppose you tell the patient for a particular tooth, you tell okay, you have to do RCT and it will surely get it will get saved, and you have not taken the IOP and you start the procedure. I know many people just simply start the procedure, and sometimes what happens is there is huge periapical abscess or there is a furcation involvement that we cannot see clinically, but if you see radiologically and you can know there is a lot of root caries. So at that time, if you tell later on, okay, ki this tooth needs to be get extracted after starting the procedure, so patient's definitely gonna lose hope on you and he will not trust you anymore. So he'll tell एक बार क्या बोला था, दूसरी बार क्या चीज बोल रहे हैं. So that is the main thing. So these things you have to control. It's a mind game basically, and you have to be truthful to the patient, show confidence. That is the only thing which will increase your patients. You will, whatever OPD is coming, they will turn into treatment. So take care guys. I hope you find this video useful. If you have not followed me on Instagram, today I have posted a photo of post-COVID mucormycosis. You can go and check. It's there in the story. So today morning it came, and about mucormycosis I'll make another video. So follow me in Sai_dental. Take care. Love you all. Bye bye.